Now, what is this keratoconus? It's nothing but a conical cornea. See, look at this picture. Normally our corneas are not so conical. This is so conical and its tip is very thin. Because the cornea is going on moving forward, that is projecting forward, it keeps on thinning. This condition is called keratoconus. Please note over here that conical cornea with a normal thickness, you have to call it ectasia. When it is thin, you call it keratoconus, but if it is of normal thickness, it's called corneal ectasia. Now, coming back to keratoconus, it is most commonly seen in females between 20 to 30 years of age. 20 to 30 years of age in females. And how will you suspect this is that she keeps coming back to you for a change in her glasses. That is within 3 months, 4 months, she keeps changing her glasses. And the myopia is also very high, about -8, -10, -12, and it keeps progressing in this high rate. Now, after you have suspected that the patient has keratoconus, you have to examine on your slit lamp, and what you're going to see, the first and the most famous sign, it can be asked very frequently, is the Manson sign. Please look at this picture. You ask the patient to look down. There is an indentation of the lower lid over here. See, this is called the Manson sign. Next, Vogt striae, these linear scratch-like markings that you're seeing on the cornea that can be seen on the slit lamp. These are the Vogt striae and characteristic of keratoconus. Please remember that we had seen Vogt striad in acute angle closure glaucoma. Okay, that is iris atrophy, glaucom flecken, and peripheral anterior synechiae. That was Vogt striad. However, Vogt striae are characteristic of keratoconus. Next, another important finding is this faint blue ring that you're seeing over here is the Fleischer's ring. This is also another characteristic of keratoconus. It's an iron ring at the base of the cone. That is, at the base of the conical cornea, there is iron deposition. This is called Fleischer's ring. But if you think about Kayser Fleischer ring, it is seen in Wilson's disease due to copper deposits in the Descemet membrane. Copper Kayser, okay? Kayser Fleischer, copper Kayser, try to remember it like that. Kayser Fleischer ring, copper deposit on Descemet membrane in Wilson's disease, okay? So the three signs are Manson sign, number 1, number 2 Vogt's striae, and number 3 is your Fleischer's ring. Now let's come to the management. The first one is your glasses. Once these glasses give up as the myopia goes on progressing pathologically, you resort to contact lens. And what you have to notice over here is that you have to avoid soft contact lenses because they do not help in altering the shape of the cornea. However, the semi-soft contact lenses or the RGP lenses, they help in altering the shape of the cornea up to some extent. So these are preferred for the management of keratoconus, that is RGP or semi-soft contact lenses. Now, after this, what happens is as it keeps progressing, it results in a condition called corneal hydrops. What happens is Descemet's membrane perforates because it becomes too thin and perforates, resulting in aqueous humor entering into the corneal stroma. This condition is called corneal hydrops. Okay, and if you leave it in that state, it will heal by scarring. It's a central scar and absolutely the patient will become blind. So your management will be keratoplasty for this corneal hydrops. Now the latest type of management that is going on these days is your collagen crosslinking. C3R or CXR, the C3 stands for corneal collagen crosslinking. What you do is you expose the cornea to UV radiation along with riboflavin. This increases the strength of the covalent bonding in the cornea and helps in reducing the thinning of the cornea. So the UV irradiation along with riboflavin, cornea is exposed to this combination and it helps in increasing the strength of cornea by improving the covalent bonding as well as finally results in stopping the progression of keratoconus and avoiding